To use ivermectin to treat COVID-19 or not, that's the raging debate in South Africa and many other countries. The South African Health Products Regulatory Authority has banned its use in humans, but some studies show possible benefits in treating COVID-19. For more on this, I'm joined by the Daily Maverick's Mark Heywood. Mark, thanks for your time. We appreciate it. Of course, there are a number of studies still underway regarding the use of ivermectin to treat COVID-19, but nothing substantial or factual. But in this desperate time, how careful should we be about using something that sounds good but isn't medically proven to be good?
Good afternoon, and thank you for having this discussion. You know, I'd just like to take a step back for the benefit of your viewers and say that, you know, ivermectin is a drug that has been registered and has been available for many, many years, for several decades, in fact. It's a drug that's registered primarily for use in animals, for parasites, but also for limited usage in humans, also for parasites. And what has happened is that in the course of research by the World Health Organization and others who are looking at old medicines to see if old medicines can be repurposed and whether they might have benefits for the treatment of COVID-19. That was how, for example, we discovered the potential of dexamethasone, whether there aren't old drugs. And so ivermectin has popped its hand up, if you like, as one of these. Yeah. Now, the difficulty we have, Shahan, is that in our country, the drug is registered, the medicine is registered for animal use, but it is not registered for human use. And therefore, the problem that we have is that in terms of the law and the South African Health Products Regulatory Authority, any use of this medicine on human beings is in fact illegal. Now, our difficulty, and this really gets us to where you started in your introduction, is that there is now evidence. There's two bodies of evidence. One, there is what are called meta-analyses, analyses that have looked back on the uses of this drug, but also there's a lot of anecdotal evidence coming from doctors, I have to say, who are saying, look, we're seeing that this thing seems to help prevent COVID-19. It seems to help people who are very sick with COVID-19, and that we feel in the urgency and the crisis that we face now, and given that we don't have any other tools, if you like, for some people, that we should be allowed to use that. So we have a very difficult ethical challenge between respecting the law and respecting the regulatory authority, both of which are very important, but also the doctor's responsibility to save life. And that is really, I think, the crux of the matter.
Mark, if I can ask you to respond to one last question quickly, because we need to go to the late Jackson and Tembu's family home where people are arriving. Just in terms of the use, we've seen doctors come out supporting the use of this drug, and that's led to people taking it illegally in South Africa. I mean, this is something that will take us back to how ARVs were rolled out in South Africa. You know, people went against what government was doing because they believed it was the right way forward. What should government do to make sure that this gets the attention fast so that we know whether it's good or bad? Because right now, it doesn't seem to be enough movement to get this drug approved or not.
You're right. There is not enough movement. And I would say two things. The one thing is, I think that the South African Health Products Regulatory Authority should seriously consider using what's called a Section 21 authorization that allows use of unregistered medicines in certain exceptional circumstances. And that would allow doctors to prescribe it and would stop the problem that we have at the moment of an underground movement where people are taking it outside of situations of medical care and medical control. So SAPRA has to look at this issue urgently and carefully, and I think has to show flexibility, even whilst we respect that there has to be careful control of medicines. Yeah. The second thing that I would say, Shahan, I know you have to go, is that the government needs to prepare. We will get definitive results very soon. Some people say in a matter of weeks. Government needs to prepare for the possibility that those results will be positive And what are they going to do to urgently make sure that this medicine, if it has the benefits that are claimed for it, can be rolled out and can play a role in preventing the carnage of death and very severe illness that we're seeing at the moment?